We're still in the midst of the pandemic, aren't we?
I think so.
I forgot to check the memos this morning, but I think we are.
I read the news this morning. We're still in it.
We're still in the middle of it.
Yes,
Okay.
yeah.
And luckily for us, our good friend, Dr. Dennis Norem from Mercy Health, has been with us since this pandemic got started, providing some information and, just breaking it down for us each and every Monday. And we're delighted that he's here with us again this morning. Dr. Norem, good morning to you.
Good morning to you guys.
1st of March. Shouldn't we be done with this by now?
Well, you mentioned we're still in the middle. Hopefully we're not in the middle. Hopefully we're getting towards the end, and the numbers are looking quite encouraging.
Yeah, we're getting to the end. I think a lot of people were planning what they're going to do for their pandemic anniversary coming up here on St. Patrick's Day. I don't know if I don't have anything special planned, but we are coming up 1 year when this happens.
Remember when we were saying 15 days to flatten the curve, 15 days. I think we've overshot that
A little bit.
Yeah, it just illustrates the fact that, and I think we were saying this a year ago, the virus will tell us what it's going to do. We're not going to tell the virus what to do. And this virus has been very interesting. And again, hopefully we are getting towards the end, but we still don't know.
No, we don't. And now we have yet another vaccine that has been cleared. Johnson & Johnson's 1-dose shot has been cleared. That now gives us a third COVID-19 vaccination. This one's a little different in that it works with just 1 dose instead of 2. And the FDA says it offers strong protection against what matters most: serious illness, hospitalizations, and death. A dose supposedly 85% protective against the most severe COVID-19 illnesses in a massive study that spanned 3 continents. What are we to make of this?
Very encouraging news. As we've discussed, this vaccine is much easier to distribute and store. So this will, I think, open up a lot of areas in the country that maybe didn't have good access to the Moderna and Pfizer vaccines. And certainly on the worldwide stage, this is very encouraging for countries that simply could not process and store and distribute the previous 2 vaccines. Plus, the cost of this vaccine is significantly less, and 1 shot is a real advantage.
That is. They're initially providing a few million doses in shipments to states beginning as early as today. By the end of this month, Johnson & Johnson said they expect to deliver 20 million doses to the U.S., 100 million coming our way by summer. They aim to produce 1 billion doses globally by the end of the year.
Well, and that illustrates that, this goal of getting everyone who wants a vaccine in this country access, I think, by summer may be realistic. The one issue that still exists is kids. I know they're working on approving the vaccines for children, and that's going to take, I think, just a little bit longer, but hopefully by fall or the end of the year, the vaccines will be approved for everybody.
So right now, is it only 18 and over vaccines been approved for?
I believe it's 16 and older for the Pfizer, and the Moderna, I think, is 18 and older. But what they're doing is they're doing studies on younger groups. So I think they're studying both those vaccines in the ages 11 to 15. And if they don't see any serious side effects and they see that they are beneficial, the FDA will allow them to go and drop down another 4 or 5 years and check another group. So they just need very small studies, basically safety studies and efficacy. You don't need to, reinvent the wheel and have to start over. So that can occur over a period of 3 to 4 months, I think, for each group. So again, I think there's hope by fall or at the end of the year it'll be approved for all age groups.
As far as which ones are best, here in the U.S., the 2-dose Pfizer and Moderna shots, 95% protective against symptomatic COVID-19. Johnson & Johnson's 1-dose effectiveness of 85% against severe COVID-19 dropped to 66% when moderate cases were rolled in. I'm not sure what that means.
Well, I think it means that it is not as effective as the messenger RNA vaccines in terms of preventing illness and keeping you without any significant symptoms, which is not unexpected as it's a more traditional vaccine similar to what the flu vaccines are manufactured in the processing. So it just tells us that you might get some symptoms of illness. You might have a mild illness, but the important things are hospitalizations and death. And it seems to be fairly effective against preventing hospitalizations and death. So I think that's probably the numbers we should all focus on.
So when we only had the two vaccines, the Moderna and the Pfizer, that essentially the same effectiveness, and I asked you, should people prefer one over the other? And I think everyone was okay getting one or the other. Now that the Johnson & Johnson vaccine's out, and it sounds like it's going to work, but it also doesn't sound like it's as good as the other ones. Will people still be able to choose which one they get? Should maybe your higher risk candidates not get the Johnson & Johnson and wait for the other ones? What do you think about that?
I think at this point, the important thing is to get everybody vaccinated. If you have access to any of those 3 vaccines, you should get it as soon as you are able to. In the big picture, we want to get people vaccinated. We're trying to move towards herd immunity. And until the FDA or someone else makes a recommendation that there should be a difference in choosing vaccines, people need to not ask what kind of vaccine I'm getting. They should just ask, when can I get a vaccine? I'll be there.
If somebody does get the Johnson & Johnson vaccine and would still want one of the other two, is that on the table for somebody to get both types of vaccines?
Not at this time, but that's a very good question. And I believe there's going to be some very significant research into trying to determine, do people with certain health conditions or risk factors, should they get one vaccine versus another? I'm sure that's going to be statistics that people are going to be looking at, and there'll probably be some recommendations down the road towards that type of recommendation. But I don't think, again, at this point in time, there's any thought that we should choose one over another. If it's available, get the vaccine.
According to what I'm looking at from the Associated Press, saying there are clear advantages aside from the convenience of one shot. Local health officials looking to use the Johnson & Johnson option in mobile vaccination clinics, homeless shelters, even with sailors who are spending months on fishing vessels, communities where it's hard to be sure when someone will be back in 3 or 4 weeks for a second vaccination. Plus, they say it's easier to handle, lasts 3 months in the fridge compared to the Pfizer and Moderna options, which now have to be frozen.
I think they've just approved, though, for Moderna, and I believe Pfizer also, that they can be refrigerated for up to 2 weeks. So that gives them a little more flexibility, but I think your point is well taken about trying to get into some of the underserved populations where people are transient, they're homeless. There's no good practical way to be sure that they're going to get back in 3 to 4 weeks to get a second shot. This has some real advantages and will certainly help those populations get vaccinated.
My sample size here is small, but it lines up with some of the things we've been talking about, and that is my 91-year-old grandma. She got the shot earlier. She said, first of all, she didn't feel anything. She didn't, no side effects at all, and her arm didn't even hurt afterwards. My dad, he got it. He said his arm did hurt for a little bit. I think he got maybe a little bit of a runny nose. And then some of the people my age, in their early 40s, late 30s, worked in the medical profession, they've got it. I think 2 or 3 of them told me that the waylaid for a day or two. They really got sick. Is that still trending, that the younger people are getting the side effects as opposed to the older population? And why?
I don't think I can answer why. I think it's still kind of a random hit or miss thing. I would say that, the older population has had many more vaccinations with getting yearly flu shots for years. So that may make some difference, but it does seem to be hit or miss. I have a physician colleague of mine that got very sick with a high fever, muscle aches, but again, it was gone in 24 to 36 hours. He's never had a problem with vaccinations before. So it is seemed to be a really random event overall. I don't know the statistics on older versus younger, if it really is significantly different.
All right. Love to get your take on this one as well. The headline reading, plunging demand for COVID-19 tests may leave U.S. exposed. And they point out that 5 weeks ago, L.A. County was conducting more than 350,000 weekly coronavirus tests, including at a massive drive-through site at Dodger Stadium. Now, county officials say testing has nearly collapsed. More than 180 government-supported sites are operating at only a third of their capacity. Dr. Clement Hong, who leads the county's testing operation, quote, "It's shocking how quickly we've gone from moving at 100 miles an hour down to about 25 miles an hour. They're seeing plummeting demand, shuttering testing sites, and even trying to return supplies that were purchased for testing."
Yeah, that's interesting. I think the overall statistics is we were up around 15 to 16 million tests a day, and we're well under 10 million now, and probably multiple reasons. Number one, the positivity rates, as you well know, has dropped significantly. The case rates are down to levels we haven't seen since September. And I think the third factor is there's all this emphasis on immunization, getting people immunizations. So I think our focus has shifted a bit. Months ago, we didn't have immunization, so the focus was on testing and try to quarantine people. But now the emphasis is really on getting the shots. And we're seeing such a plummeting rate that people just aren't getting tested. And to some extent, that's a good thing. There is a concern, however, if people kind of get too lazy about getting tested, that we're going to see an uptick. And certainly it's important to continue to get testing because of the variants that we need to be aware of and to see what the effect of those are going to be on what our rates are as we move down the road.
Yeah, some of these numbers, U.S. testing hit a peak on January 15th when we were averaging more than 2 million tests a day. Since then, the average number of daily tests has fallen by more than 28%. The drop mirrors declines across all major virus measures since January, including new cases, new hospitalizations, and new deaths. Those are encouraging, but as you pointed out, all of a sudden we're not getting tested anymore. Now comes the uptick.
Yeah, and we just don't know. I think the biggest concern about the uptick are the mutant variants in terms of the immunity, and it looks like we're still doing fine in that the vaccinations seem to still be effective. So time will tell whether that remains, but so far so good, I think.
Yeah, it does seem like once we rolled out a couple of vaccines, everybody said, "Oh, we're done with testing. Screw it, we're done there." But we obviously will need it, especially as this thing comes around maybe again next year. We used to talk a lot about at-home testing for coronavirus. That could be beneficial down the road here. Any progress on that?
I think the FDA has approved a test, but I don't know if it's commercially available yet. I haven't seen anything recently on that. I know there's a big push to have at-home testing.
Because that could be very beneficial to come next year, right?
Well, it certainly could. And in that people, if they start testing themselves at home, we could probably potentially pick it up, sooner than having to go through an official testing site. Certainly, if somebody has a positive home test, they need to get that confirmed. But it would be very helpful in terms of surveillance to be able to test and see if we're going to have a wave, because we just don't know. As this thing dies down, is this going to be an annual epidemic type thing like we see with flu? I don't think anybody knows yet. We assume it's not going to go away. I think that's a pretty good assumption, that we're going to have little outbreaks as we move down the road. But again, we just don't know.
Yeah, and the at-home testing would be an interesting thing, and yeah, they are available. There are places that you can reach out and try to grab yourselves one. Cheapest option that I'm seeing here, priced at $109. Most expensive test offered is at $155
per test.
Yep.
Oh,
per test. All but one of the companies require upfront payment for their testing. These have been FDA approved.
Yeah, I know they've had, the saliva testing you could mail in and that kind of stuff, but I think these are tests that you can do at home and actually get a result yourself at home.
Yep. Everly Well, Let's Get Checked, Picture by Fulgent Genetics, Pixel by LabCorp, Vitagene, P23 Labs, Vault, Hims and Hers, and a company called Phosphorus. And you got to complete a questionnaire and an online consultation and some other things, but Yeah, it's not quite as simple as just buying it over the counter, going home, spitting in the tube, shaking it, and going, okay, I'm fine.
Yeah, I think people kind of are expecting at some point it'll be like pregnancy testing at home. You just take a little sample and you wait a few minutes and it'll be positive, negative, and you can go from there. I think we're a long ways away from that. And certainly the cost is going to be a deterrent. Don't think a lot of people are going to want to spend $150 and then know that if it is positive, they probably need to get it confirmed.
Right, and which means you pay again.
Yeah.
Yeah, $150 a pop. That's not going to help later. I don't even know who's using that at all.
No, unless you got money to burn and you're just thinking it might be a nice novelty gift for everybody in the office.
Yes.
I don't see it happening.
Like literally have money to burn at that point. Yeah.
Nope.
So,
Well, the one place that it might be helpful is traveling. I think you're going to see requirements to have to be tested or have vaccinations prior to travel. So maybe there'll be some use there that companies will allow people to bring in their home test or do their home test right before they get on the plane, the boat, or whatever they're doing.
Yeah, well, all right. Little steps, but we're making them. Progress is being made, as you can see every day when you look at some of those numbers. Dr. Norem, as always, we appreciate the time. We appreciate the expertise. And as we pointed out, all right, maybe we're not halfway through, maybe not midway through. Maybe we're getting toward the end of it. But we'll look forward to talking to you once again next week.
All right, I'm sure it'll still be here next week.
I'm sure it will.
I'll keep reading the news.
Yeah, we will, just to be on the safe side. That's Dr. Dennis Norem from Mercy Health.